Hi, my name is Nancy Bartlett. I'm a family nurse practitioner student at United States University. Today is December 14th, 2025, and we are here for a musculoskeletal exam. I'm going to do a quick turn of the room for transparency. We are in an actual patient room, so there are some patient paraphernalia, things like this on the walls, but they are not my notes. My leftover Snell from another test we were practicing. Ceiling and floor. Make me dizzy. All right. So, like I said, we are here for a musculoskeletal exam. That will be uploaded to YouTube for educational and grading purposes. Do I have your verbal consent to do so?
Yes.
Great. For educational purposes only, I'd like your initials, please.
JB.
Great, JB. We're here for a musculoskeletal exam, like I said, and so I am going to get started. I am just going to adjust this just a little bit so they can see what I'm doing. All right, so the first thing that I'm doing is I am just inspecting the musculoskeletal system, and everything looks symmetrical. I don't see any deformities. I see good muscle tone. I see good color for his ethnicity. Yeah, no lesions. The next thing I'm going to do is I'm just going to palpate those joints, and I'm just touching. And let me know if you have any tenderness anywhere. And I'm just going to reach through and I'm just going to... Any discomfort anywhere?
No.
Great. So joints feel symmetrical. I didn't appreciate any kind of deformity, any kind of swelling or any warmth. The next thing I'm going to do, since you're already sitting, is I'm just going to check for sensation, if that's okay with you. So I'm going to have you place your hands, actually right there is perfect. And so what I'm going to do is I'm going to show you what I'm going to do. This is dull, this is sharp. And so I'm going to touch you and I want you to tell me dull or sharp. And I want you to close your eyes while I'm doing that. Ready?
Dull, sharp, dull, sharp, sharp, dull, dull, sharp, sharp, dull, dull, sharp.
Great. So sensation is intact to both upper and lower extremities bilaterally. You can open your eyes. Thanks. The next thing that I'm going to do is I'm going to palpate the lymph nodes. Epitrochlear. Okay. And then I'm going to palpate the axillary, and I'm going to start at the medial, and then I'm going to go anterior, and I'm going to go lateral and posterior, and then again I'm going to do it on this side also. So epitrochlear, and then anterior, lateral, and get right in there in that posterior. Thanks, Jamie. Next, I'm going to assess those reflexes. So the first one that I'm going to assess is the bicep. And so there it is. Just relax. Great. Just relax your arm down. Great. Let me have this arm and just relax. I'm going to find that spot. Okay. Tricep. Okay. Brachioradialis. So, notch. Go down. gonna assess the patella. And lastly, the Achilles. Okay. Oh, Babinski, which is negative. The next thing we're gonna do is I'm gonna have you stand, and I'm gonna have you face the wall, and I am just gonna have you bend over if that's okay. And I'm just gonna raise your shirt, and I am just looking for spinal symmetry. So I just see normal curvature of the cervical, lumbar, and thoracic cavity. I don't note any lordosis, kyphosis, or scoliosis. Good job. I'm gonna raise this rail. We're gonna do some range of motion. I'm gonna stand right here, so I'm not out of camera completely. Let me get up here. Okay, so the first thing that I want you to do is go ahead and raise your arms all the way up and across your chest and back out and down. So that is shoulder abduction and adduction, and raise your arms up over your head and all the way to the back. That's shoulder flexion and extension. Take your arms out to the front and raise them up and back. That's elbow extension and flexion. Go ahead and hold on to the side, and I'm going to have you raise your leg all the way out and back down, and do it again with the other leg. Yep, and back. That is hip flexion and extension, and if you can take your leg all the way out to the side and back, and the other side and back, that is hip abduction and adduction. And then I'm going to have you raise your knee up and straighten it all the way out and down, and do it with the other one, up and out. That is knee flexion and extension. And if you could, I'm just gonna pull the camera down with me sort of in frame, and lift your foot up and point your toes to the sky. Perfect, and point it all the way out like a ballerina, and do it again with the other foot. Up to the sky, point. So that is pedal flexion and extension. While I have you up, we're also going to demonstrate the empty can test. So if you don't mind putting your arms straight out with your thumbs down. And I'm gonna put your arms here about right there, like a 35 to 40 degree angle. And I'm gonna press down while you resist. And so that, any discomfort or pain? No, so that is a negative finding for the empty can test. Next, we're gonna do muscle strength. So the first thing I'm gonna do is have you grip my fingers as hard as you can. Great. And hands out. And don't let me squeeze your fingers back. Great. Arms up. And I'm gonna push and I'm gonna pull. So that again is bicep and tricep. Arms straight out. And I'm gonna push down. That's deltoid. I'm gonna have you have a seat. So I'm going to press down, resist. I'm going to push in, you push out. I'm going to push out, you push in. That's hip flexion, abduction, and adduction. I'm going to push against your shins, and I'm going to pull. So that is quadriceps and hamstrings. And I'm going to have you push like you're pushing on the gas pedal, and push up, resisting me. So that is dorsal and pedal flexion. And range of motion is 5 out of 5. It's symmetrical. which is great. The last thing that we're gonna do is I'm gonna go ahead and have you stand and just walk for me. Walk forward and go ahead and turn around and walk back. So gait is smooth and steady. And I'm gonna go ahead and have you do a tandem walk. So if you don't mind, yep, toe to heel to toe and back. So tandem walk is intact. And that concludes our musculoskeletal exam. Thank you.